Great. So thanks everyone for attending. As I said, I know we'll have some more folks joining us throughout the next hour and a half, but we're really excited to have you here. My name's Marissa McCool. I'm the Executive Director of the Wallace Center for Maternal, Child, Adolescent Health here at the School of Public Health. We were able this summer to step in, provide some structure, collaborations, and funding to support student internships. We are really proud to say that we're able to place 9 students in 8 different partner organizations. Those are both students who are completing the internship as a part of their required practicum for their MPH and recent graduates. And the Wallace Center, alongside a partnership with our Best Baby Zone initiative, we're able to provide supplementary funding or match funding from organizations, and we were able to provide students with a total of $60,000 in funding this summer, which we're really, really proud of. And we're excited to hear more about what the students completed this summer, the various technology and innovation components, the various racial equity components. I do want to say we have a packed agenda. We do not have set breaks, so please feel free to step out if you need to, grab some water, whatever you need to throughout the next hour and a half. This will be recorded. And I will pass it to Kim Harley, our faculty director, to tell you a little bit more about what Wallace is.
Thanks, Marissa. Thanks for being here, everybody. We're really excited to hear about everybody's internships. We've been super pleased with all of the relationships we've been able to build with the different organizations, and we really are excited to hear what you guys have been up to. Just for people who don't know much about the Wallace Center, we're a fairly new center, and our focus is on maternal, child, and adolescent health, and we're specifically interested in how we can use technology and innovation as sort of a writ large to really move the needle on improving health equity and improving maternal child health for the most at-risk populations. We are very much focused in a sort of a social justice kind of framework and a community involved kind of approach. And we're excited to be partnering with all these different organizations. I think I'm not gonna say much more because it's 3:05 and let's see, Kate is our first person, so maybe we should let her get started.
Great. Kate, I've made you a co-host, so you should be able to screen share and get started.
Sounds good. Let's just share this with you. Okay, can you guys see my slides?
Yes.
All right, so hi everyone, my name is Kate Walrath, and I actually graduated in May from the Health and Social Behavior program. And I'm going to talk to you about my summer internship with Find Connect, which is a program within the UCSF Benioff Children's Hospital of Oakland. Okay, so Find Connect is a pretty innovative technology. It's a secure, HIPAA-compliant, cloud-based platform that you can log into basically through your internet browser that guides patient navigators through the various functions needed to screen, refer, and follow up with patients to address social determinants of health. And so it originated from the Family Information Navigation Desk, FIND, a program that was first piloted in 2012 to help connect families to summer activities and resources for their children within the primary care Claremont Clinic, which is associated with the Children's Hospital. And then since then, FIND has expanded its screening and referrals for families in the primary care clinic, and Find Connect was developed in 2016 to aid navigators kind of through this screening and referral process. So it guides navigators through an opportunities assessment and other screening surveys as indicated. And then after completing this screening, it suggests referrals based on the family's indicated needs and their location using an algorithm that's built into the platform. And it was a recent pilot project that was added on, was launched in July of 2019, which provided funding for a navigator who would provide virtual navigation services to some families that are being treated by primary care physicians outside of the clinic and with other physicians in the county. That's like a little bit about it. And then just going through the workflow for the navigators, because it's kind of helpful before you get into my project. So families can either self-refer themselves at the Find desk, which is located within the clinic, or be referred through their primary care provider. And then navigators enroll families and conduct a screening. And then taking into account the responses of the screening, they develop an action plan that has referrals and information for families. And so this is where that algorithm is built in that assists navigators in pooling resources based on their needs and location. And so like kind of on the other side, a knowledge base of resources has been developed and maintained by the navigators in the Find Connect program. And so it's a whole list of like over 200 resources for the East Bay that are different based on needs. And it provides kind of all the information, like the link to look at their website, program eligibility, location, and contact info for the program. And so then after the referrals are made, that action plan is agreed upon by the family. The navigators will follow up with the caregivers every 2 weeks or so for up to 6 months to provide additional assistance and see if they've accessed those resources. And I think they're really trying to empower the caregivers to try to access the resource. But if they need help and like more of a warm handoff, they will. Well, that's what the follow-ups are there to do. So just to get a little more information about like what the screening entails. So the main screening is called the Opportunities Assessment, and it assesses families for a variety of needs, including a lot of the ones that I've included here. And so basically they kind of ask the caregiver about what areas they feel are areas that they need help with. And then if they indicate a certain category, there's a lot of different questions that the navigator then asks to get a better understanding of the specific needs. And so then at the end of the screening, the navigator works with the caregiver to identify up to 3 priority needs that they'll really focus in on for this action plan. So my project was kind of 3-part. So I first was working to review and update the program's logic model. And then second, I was working to kind of create a database schema and a data dictionary for the Find Connect platform, and I'll give you a little glimpse into that. And then the main piece was doing a data analysis, looking into the data to see what it was telling us. And ultimately, I wanted to understand if virtual navigation was as effective as the in-person navigation. Okay, so this is a screenshot of the logic model as I edited it. So Find Connect already had a logic model that was created, but it didn't quite align with what they were focusing on today. 4 years later, it had a lot of like the policy and advocacy, but we wanted to focus in on what the hopes of the navigators providing this resource were. So I kind of cleaned it up and made it fit to what we thought really the logic model should look like. And then in that process, I realized that there were very few of the outcomes in those last 3 columns that the program was measuring. And so I incorporated notes to indicate which were not tracked currently, as well as some recommendations for which ones of those that weren't tracked are feasible to be tracked, and I would prioritize to be tracked, because I think it can be useful to show your effectiveness that you're able to measure these outcomes, and it can be really important for funding as well. Okay, so then this is a picture of the data schema I created. And you don't have to understand it all, but so basically the database, I wanted to show how the database worked kind of on the back end and make it easier for someone to do a data analysis. Like it makes it quicker if you can understand how it works. So each rectangle here kind of represents its own table. And so each table, as it's exported out of the database, comes out in one CSV file. So these were the tables I was interested in looking at. And so there were 8 tables, and I had to figure out how they all fit together so that I could clean the data and then join it all together before I could do the analysis. So this is like, I think it was fun for me, but for some people it's a little confusing here. But I think it'll help make the understanding of what tables you need to be able to do different analyses in the future. And then this is just a little screenshot because there's a ton of different fields within the database. But I created a data dictionary of sorts, and so that was really kind of showing like a detailed map of the database. And so each different color here is a different table, like those rectangles in the previous one. And like the field names as they present on your internet browser are different from the way they're exported. So it's kind of like making a key for that as well as a key for the responses, because often responses in the database are coded as numbers. But you need, if you're trying to do an analysis and you want to look at like certain age groups, you need to know what the numbers represent. Yeah, so I just kind of, hopefully these are all some pieces that they'll have in the future to get the data analysis going quicker. Okay, and so then I got to my bigger project of the summer. So as I mentioned earlier, I was interested in seeing how virtual navigation compared to in-person navigation. So at first I looked at the demographics to get an understanding of the families and children that were being served through the 2 different kind of types of navigation. So this dashboard, and I did this all these visuals in Tableau. So this dashboard shows total enrollments over time. And so you'll see, that's on the left-hand side. In the teal is the in-person navigation. And so you'll see that the total enrollments are going up over time, which makes sense as they're kind of expanding probably how many navigators they've had, as well as how many people they're able to enroll. And then on the bottom, you'll see the total enrollments for virtual, which is sometimes I also refer to as CFMG because that's the name of the pilot project. But so it's only a year of data, so it looks a little more all over the place. But for both, you'll see that there is a dip in that spring 2020 because of COVID. So that makes sense. And then looking on the right, you'll see we'll see the number of enrollments by family zip code overlaid with the median household income for that entire zip code. So that's not people that are enrolled in the program, that's the whole zip code. And so the lighter the red, the lower the median household income. And so looking at both in-person and virtual navigation, you'll see that the enrollments tend to be in areas of lower median incomes. And so that makes sense given their target population and the fact that the clinic is a federally qualified health center. So they are serving lower income families. Oh, no, okay. And then I looked a little bit more at, I might need to go quickly. I might skip this one, but basically it shows that there's some differences in the families that are being served between the two, in-person and virtual. in person, the children, there's more children who identify as Black, as opposed to the virtual saw more individuals who identified as Latino. And virtual was like an older demographic of children, like above 6. And then the clinic served more people who were between 0 and 3. So it's showing kind of that they're not exactly comparable, but that wasn't, the goal of the project wasn't to do like a perfect study. It was really to look at the differences. Okay, and so then in this next one, we looked at the results of the screening. So the first graph on the top shows families who were served in person were more likely to have 0 priority areas identified. And this makes sense because with the virtual navigation, there's less self-referrals of people just walking up to a desk. And then there's also the fact that providers kind of have to go through a more time-intensive process to refer patients via fax, as opposed to just walking them over to the desk in person. And then the second graph looks at the most common priority areas. And so those were pretty similar across the 2 programs, with outdoors and other activities, food, and housing as the top 3. Okay, and so then we get into looking at the number of services received by each program. So for each of these 3 services, in-person is on the left and virtual is on the right. So you'll see virtual enrollments on average received more than double the number of referrals and number of follow-ups. So these 2 on the left. And then meanwhile, in-person enrollments on average had a larger number of successful referrals than virtual, though it wasn't statistically significant, as you can see from the confidence intervals. So when I presented this to the team, we realized that a lot of the referrals that were made in person were programs that were to programs that were kind of available in the clinic or in the hospital. So basically, it kind of went beyond a warm handoff of like actually handing the person off in person to that resource that they then were able to successfully get.
About a minute left.
Yes, I'm one more slide. So this finding highlighted why a program that is in person can be super powerful, especially in the setting where some of the resources that the families could benefit from were right there. Okay, so now my takeaways. So while by no means this was a perfect study, it suggests that virtual navigation can and should be utilized to increase families' access to resources, especially during this time of economic hardship and COVID-19, where telehealth is more common. And then at the same time, I think it provides a case for why in-person navigation is so important, especially when there are those resources available in the clinic themselves. And so I think just to mention the skills that I learned, this internship really strengthened my skills in identifying a research question and cleaning and implementing the data analysis, kind of doing the whole project from start to finish. And then specifically, I learned a lot in creating visualizations in Tableau to support my findings. That's it. Thank you.
Great, thanks, Kate. You're welcome to stop your screen share and we'll make time for 1 or 2 questions from the audience. If anyone has a question, feel free to unmute yourself or raise your hand or write in the chat box. Any format's welcome.
Yes.
Hey, Kate, this is Jaspal. Thanks for the presentation. You've already answered one of these questions about surprises. I'm curious what in your data analysis was surprising, not for you, but for your team that's been working on Find Connect to date. You mentioned one, which was around, the in-clinic resources being really just like more than a warm handoff. I'm wondering if there was anything else that really stood out.
Yeah, I think it was exciting. I think it was really exciting for them to kind of be able to see the things that they were really experiencing in the clinic all the time. I think like a lot of the information seemed to make sense and they could explain it in their head. But I think the one thing that was a little less was surprising was that there weren't as many successful, or the average number of successful referrals was lower for the virtual navigation. I think it makes sense intuitively, but I don't think they were quite expecting that.
Right on, thank you. And one small suggestion, I don't know what your future plans are, but I'd suggest if you can, maybe in 6 or 12 months going back and just checking with your counterparts to see how things are going, because it seems like, you know, with your revision of the logic model, with the database schema work, with setting up kind of this framework for data analytics and visualization, that you've done a lot of foundational work for them. And so it might just be interesting for you to see what kind of impact that has, you know, 6 or 12 months down the line.
For sure.
Great presentation. Thank you.
Thank you.
So given time, we just have about a minute before Michaela presents. So I think we're going to transition. But thanks, Kate, for your presentation, and Find Connect as well. I don't know if Dana's on this call or your other teammates, but they're great partners and we appreciate them working with us too. Michaela, I believe I have made you a co-host, so you should be able to screen share and get started.
Okay. Okay. Hi, everyone. I'm Michaela, and I'm a second-year MPH student in the Health and Social Behavior concentration, and I'll be talking about my internship experience with Expecting Justice this summer. So just to start, Expecting Justice is a collaborative mobilizing leaders across San Francisco to improve pregnancy and birth outcomes for Black and Pacific Islander communities in San Francisco. So it's a collective of the UCSF Preterm Birth Initiative and the San Francisco Department of Public Health. So the ways that they're doing this work, they have 3 strategic focus areas to address those key dimensions of vulnerability faced by Black and PI people during pregnancy and childbirth in San Francisco. And those strategic areas are interpersonal and institutional racism in healthcare and public health systems, and then structural racism as manifested in the racial wealth gap. So the 3 main programs that Expecting Justice has implemented as kind of innovative solutions for addressing racial maternal health inequities and within those communities is the Program Implement Supplement, which looks at addressing the structural racism that shows up in the wealth gap, and then the Doula Access, which is geared towards providing advocacy for those women who may be experiencing interpersonal racism during their pregnancy with the systems that they interact with. And then lastly, anti-racism promotion, which is geared towards looking at interpersonal as well as institutional racism. So the 2 main projects that I worked on was one, the Abundant Birth Project. So the Abundant Birth Project is an innovative collaborative intervention to provide an unconditional income supplement during pregnancy to 150 Black and Pacific Islander pregnant women in San Francisco. This is geared towards addressing those structural inequities in wealth, which are correlated with negative pregnancy and infant outcomes. And then the second project that I was on is called Heart Up, and that's an online heart-centered anti-racism training for providers, public health professionals, and institutional leaders who interact with pregnant people. So some of my goals going into the internship, I was fortunate that I had the opportunity to think about professionally what I wanted to build towards, thinking post-graduation, and then also personally what I wanted to work on during this experience. So professionally, I wanted to increase my understanding of the ways that racism impacts health outcomes, especially health disparities. And then I also wanted to demonstrate some skills with curriculum development, understand CBPR principles practically, how they were applied to the Abundant Birth Project, as well as like building skills with qualitative research, and then gaining experience with writing skills, so public health communications and writing reports and things like that. And then of course, building professional relationships and networking. And as far as my personal goals, I was encouraged to, and I also wanted to pick some goals that would make me uncomfortable and push myself. So I made a goal around like learning to and building some skills around addressing racism as it shows up in some of the spaces where I am professionally and personally, and also speaking up and sharing more ideas in meetings, which is kind of getting at some of my own like internalized imposter syndrome. So I think it was really good for me to have those goals at the beginning of my internship, and then having the support to work on them with the team. So the Abundant Birth Project, I joined this project. Here I kind of laid out some of the deliverables that I got to work on during the project. So I joined during the design implementation phase, and this was right around when the community researchers, which are Black and Pacific Islander women on the team who have a birthing experience as well as experience in birth justice, they just finished doing informant interviews with other Black and Pacific Islander moms in the San Francisco community. And they were really looking at like a needs assessment as far as what have been those moms' experiences with social services as well as their financial needs. And so I was able to join in at the tail end of that. So I got to assist with creating the data metrics. And we also did like a rapid assessment process to analyze the qualitative data. And so I got to help with writing memos for that. And then those memos we used to inform our design thinking workshop, which is like a design sprint that we used with the participants who were also interviewees during the needs assessment, and to design the Abundant Birth Project. So it was a really valuable experience for me being a part of the design sprint, because I was able to see like how even virtually there was a creation of like community, and how engaged the moms who were participating were. I could tell that the experience was very personal and they were really engaged in the work. And then also being able to see how the community researchers were co-leading that design workshop, and then also facilitating the focus groups. So I got to be a part of the welcome committee for the design sprint. So one of the deliverables you'll see here is the journey map. And so we took the memos that we had with the qualitative data, and we created like a journey. So we wanted to give this to the moms as like context while they were designing. And it goes over kind of like, what are the system-wide structure factors that showed up, the community factors and personal resources that were coming up, like the patterns that showed up in the needs assessment, and kind of transforming that into a visual for them. And then I also got to create a general grant report for funders that hadn't necessarily requested a report. And this is available on the Abundant Birth Project webpage on the Expecting Justice website if you want to check it out. And it's mostly highlighting the community researchers and the different ways that we're able to like be resilient through the pandemic, and also really uplifting the community voices. And then the last thing that I have photographed, or that I showed here, is the implementation report, which is a more in-depth detailing of the different activities during the design phase. And so this is an ongoing process, and it's a deliverable that will be completed by the end of the year for some of the funders. Okay, and then with Heart Up. So again, this is the online training, the Heart Center online anti-racism training. So there's gonna be 5 different courses, and when I joined in, there were already 2 courses. So I got to be a part of creating the third course, and that meant like creating the outline as well as supporting like the collaborative writing process. And I got to actually be a part of the writing process, so like script writing and thinking like creatively around like visuals and how to keep participants engaged. And then with the very first course, the introductory course, I got to do the beta testing. So I designed the survey as well as like collecting the data. And I actually, which I kind of showed over here, is I created a like coding sheet. So that was my first experience with coding qualitative data. And I kind of got to pull from the experience working on the ABP project to be able to do that. So I put that together in a presentation, which I gave to the team so that we could come up with recommendations and changes for the production team. And another cool thing that I got to do was I created a Gantt chart in Excel. And it's just interesting, like being able to learn some like really practical project management skills. So that was valuable for me. And then as far as highlights go, so working from home wasn't something that I particularly wanted for myself or saw for myself, but I feel that I was Expecting Justice does a really good job of creating community, and that's something I'm grateful for, and that I feel like I was able to learn from them, especially with the online format. And then I did have the opportunity to meet them in person. So what I pictured here was the craft day that we had. We made those bookmarks together. That was a highlight for me. Another highlight was during the steering committee, we did racial affinity groups, and we broke into those groups to do like work on anti-Blackness within different communities, how they show up. And I thought it was really valuable to see how we could use those racial affinity groups, as well as being able to be a part of like creating that activity and like how it would flow was really valuable. And then I also got to be a part of some topic discussions around like media advocacy and addressing the elephant in the room, which if you haven't heard that term before from Zaya, it's around like calling out racism where it shows up. So I think I talked super fast. The takeaways for me, I really got to expand what it means to like expanding my imagination to what it means to practice anti-racism and addressing racism as a root cause of health disparities, especially with the Abundant Birth Project, just looking at practically and meaningfully how you can address structural racism was really valuable for me. And I hadn't really even thought before that that was possible. And then also supporting interventions that are for the community and by the community was extremely valuable for me. And I got to, of course, pick up on some project management tools, qualitative data analysis skills, and then writing skills with public health communications. And then I just, as a closing statement, was gonna say that the work was deeply personal to me, and it provided me an opportunity to bring my culture and my story to the work. And I'm extremely grateful to the Wallace Center for making the funding for the opportunity possible, and also to the Expecting Justice team for investing in me and allowing me to learn. And that's it. I'll open for questions.
Thanks, Michaela. I think everyone's clapping. You're welcome to stop your screen share if you'd like. We do have time for a few questions. Anyone in the audience is welcome to ask, students, staff, partners. So if you have a question, feel free to unmute yourself or even type in the chat box.
Okay.
And if folks want to put themselves on video so we can be in the room together, you're welcome to as well. Yes, Andola, you can go.
Oh, hi. Thank you so much for the presentation. Excellent presentation, Michaela. I wanted to ask you a little bit, what was your sort of experience with the participatory part of the project?
Yeah, my experience was, I think what I really took away from it was learning how to invest in the community while uplifting their voices. Like, I feel like what Expecting Justice is doing by having the community researchers at the forefront is really valuable, as well as just, it's valuable in a way of like, the moms who participated like in the design sprint, for example, were very engaged, and they were like speaking a lot about like gratitude for being included. And I think the investment part also comes from paying them for their expertise, which both people have, the community researchers expressed was really valuable. Is that answering your question?
Yes, thank you.
Other questions, comments?
I have a question. I think the abundant birth, I think everything that Expecting Justice does is really awesome, but I'm really interested. I really think that the Abundant Birth Project is so fascinating, and it is such a great opportunity, such a great project. And I'm wondering, you know, where are you in the kind of the process? And maybe this is a question for Zaya too, but I know you're doing you're doing the design sprint part now, but this is an income project, right? And is that something that has that started happening yet, or are you still building towards doing the, you know, providing the income portion of the project?
Yeah, so I'll take a go first. So right now, we actually did the design sprint in July. And so we're taking the data from that experience and we're creating prototypes. So we're actually still in the development phase and planning to start distributing the supplement in early next year. So we're still working out like eligibility and like how it will be distributed and those types of questions.
We're definitely watching this one. It seems like such an amazing project. So it's good to know the timeline so that we can keep track of how things are going.
Awesome.
We have open positions, so if anybody is interested, we have open positions. We're also interested to see how it turns out.
Michaela, I have a question for you. What was your biggest surprise? Like, what did you go in thinking like, oh, I got this, and then like, what was like, what? What was that? I'm just curious.
I think my biggest surprise is the way that Expecting Justice like practices anti-racism like in the work environment. Like one of the stories that my coworker shared with me was around like when she came to her interview and Zaya told her like, you do not have to like conform to any standards of white supremacy here. And just like really seeing how everyone was super comfortable like bringing their entire selves to the work, and how everyone in the team, the research team, was very like just bringing their entire selves and very invested in the work. That was a complete surprise to me. Like, I feel like I haven't worked in an environment like that before.
I think we have time for one more question or comment. If anyone in the audience, students, partners, anyone wants to share anything, feel free.
Well, I have a question, if that's okay. I'm wondering, Michaela, like looking forward now into this next year of your public health degree, in what ways are you kind of approaching your second year of public health school differently because of what you experienced this summer?
Yeah, for me, what I'm approaching school differently is I've already started becoming more involved on campus. So I joined the Bay Executive Board, which is the Black Advocates in Equity for Health. And I think I want to be more active about going after experiences that allow me to practice some of those skills that I wanted to build up, like around anti-racism. So while I have the opportunity to be in school, just practicing those skills, I think has given me a direction.
Awesome. Thanks, Michaela. We're so happy to have you as a student at Expecting Justice. we are going to transition to Elle now. And so Elle, I have made you a co-host. You should be able to screen share.
Great, thank you. Can we see those slides okay?
Yes.
Kahe, Sho'odachi, Balashe Ba'a Weche'a Uk. Hello, my name is Elle Ford. And before I move along, I want to acknowledge that where I'm presenting today, and maybe where some of you are sitting as well, is on the traditional territory of the Chochenyo Ohlone tribe. Thank you all for being here today. It's been such a pleasure to see all of the beautiful work you've done this summer. My position this summer was an externship co-sponsored by the Wallace Center and a nonprofit organization called Momentum Park. So at Momentum Park, we believe that moms come first and every moment matters. We are committed to eradicating maternal and infant mortality through the integration of medicine, public health, policy, and technology. Our aim is to promote the health and well-being of expectant mothers and newborn infants. To date, the majority of Momentum Park's efforts have centered around raising awareness and increasing knowledge on the existence and prevention of maternal and infant mortality. Now, we are continually raising awareness while putting boots on the ground and making actions happen through research, health promoting programs, and technology as well. We believe that healthy moms that have healthy pregnancies give birth to healthy babies who grow up to be healthy adolescents and eventually adults who may also have children, resulting in an endless cycle of healthy life. And we want to be part of fostering this healthy life cycle. And I was lucky to join Momentum Park at the time that I did. It's in the pre-seed phase, which is when an organization is getting its operations and finances off the ground. And so for me, this meant that my voice was heard, my ideas were listened to and implemented, and I was thrown into the nonprofit world in an environment that has both allowed me to learn and grow, but also put my own expertise to use. And this is the lovely team that I worked with this summer. On the far left is Dr. Renesa Anthony, a holistic healthcare powerhouse. I worked with Dr. A on operational, creative, and programmatic tasks. Next is Dr. Sylvia Gwendelman, who, as many of you may know, is an MCAH goddess and the co-founder of the Wallace Center. And Dr. G and I worked on the research-based goals. And then there's me, a recent graduate from UC Berkeley. I focused on maternal, child, and adolescent health, food systems, and Indigenous reproductive justice. I entered in a temporary contract position this summer, and I'm proud to say that I've just gotten hired on as the maternal and child health specialist. Thanks. So my position this summer, these 3 past months, I was lucky enough to work on many projects. I was tasked with research-focused goals, program innovation, starting organizational functions, and the timing of my involvement with this org gave me the chance to collaborate with Dr. A on the future vision of Momentum Park. On the research side, I coupled with Dr. G, and we dove into a data set that Momentum Park's team had collected in the previous year. And together we crafted a research question and have begun data analysis to soon complete a research paper. We are now examining the relationship between African American perceptions and awareness and knowledge of maternal mortality and the role of technology and how it can aid in closing the racial gap in health outcomes for African American moms and babies. On the organizational side, I teamed up with Dr. A to get momentum behind Momentum Park. I first began learning about the org, where I fit in, and how I can use my expertise not only as an African American and Indigenous woman, but also as a recent public health graduate student, and how this could shape the organization. This opportunity allowed me to have many roles, from design tasks and website building to research, grant writing, and the process of creating a needs-specific, pregnant woman-centered, culturally competent program. So at Momentum Park, We provide services to all women, but focus on those that need help the most. We know African American women suffer the worst pregnancy and birth outcomes, including but not limited to maternal and infant morbidity and mortality. Both African American moms and their babies in the US have mortality rates over 2 times more than their white counterparts. In the US, the maternal mortality rate was 17.4 per 100,000 live births in 2018, according to the CDC. And the infant mortality rate was 5.7 deaths per 1,000 live births, also in 2018. Both of these images on the screen show 2018 CDC data, and they really illustrate this disparity. You can see that African American women and infant mortality rates are far greater than their white, Hispanic, Asian, and Pacific Islander counterparts. We cannot and will not accept this status quo, and we aim to close this gap. And one of the approaches to this goal is through SHERO. So what is SHERO? SHERO stands for Shaping Healthy and Empowered Reproductive Outcomes, and it is a timely and innovative digital solution to address the prenatal needs of pregnant women. It was designed in response to COVID-19's impact on our traditional on-the-ground programs. What we envision is an online community that integrates technology and public health with social services and prenatal support. COVID-19 has severely impacted the delivery of prenatal care and centering programs, and centering is a unique style of prenatal care in a group format. The standard 12 to 15 prenatal care visits have decreased, telemedicine has increased, and limited data exists on the impact of such changes on pregnancy and birth outcomes. The COVID-19 pregnancy experience also changed what was a community woman-centered ecosystem into an isolated one where women attend prenatal visits alone and only one person is allowed in the delivery or operating room for the birth. We hypothesize that both the pandemic coupled with social unrest currently is exacerbating disparities for pregnant African American women. These challenges are not insurmountable and represent the ideal opportunity for the success of SHERO. A little bit more about this, the SHERO model. So SHERO works as an ecosystem. We will have pregnancy pods of 8 to 12 women, which is based on the centering model of a successful group size, between 18 to 14 weeks estimated gestational age. Pregnancy pods convene weekly through a secured virtual conferencing room for an hour and a half. And these sessions include a 15-minute welcome, a 30-minute educational session led by a licensed BIPOC healthcare professional covering what to expect that week during pregnancy, followed by a 15-minute Q&A session. And then the remaining 30 minutes is an interactive, facilitated discussion covering a myriad of topics, including basic need resources and topics like pregnancy during COVID, Black Lives and Babies Matter, romance and intimacy, and many others. SHERO's online ecosystem will also offer comprehensive lists for needed items like supplies, social services, and local hospital and birthing center locations. Also offered will be a mama marketplace, which is a place that moms can buy, sell, and trade any pregnancy-related items that they may need or wish to part with their fellow pregnancy pods. We want SHERO to be a one-stop shop for moms and their needs. And moving on to the research side of my internship. In the US, disparities exist and they persist between varying racial and ethnic groups when compared to their white counterparts. But are these groups aware of the problem? Do they perceive the problem as existing or see the magnitude of it? You see, having correct knowledge about a problem, perceiving that there is a problem, these are the things that can change and lessen disparities. Perception and awareness are necessary preliminary human behaviors that foster knowledge, drive motivation, and eventually compel one to change within their community. Without awareness of the problem, we cannot expect disruptions and disparities to occur. The current very limited data on this topic indicates that racial and ethnic minority groups are often unaware of the disparities that affect them directly. A 1999 study done by the Kaiser Family Foundation found that the majority of Americans, particularly those within racial and ethnic minority groups, were not aware that African Americans fared worse than their white counterparts in infant mortality and other vital health indicators. Another study in 2011 by Health Affairs found some striking realities. They discovered awareness of many important health disparities remained quite low, even among those within the groups that are disproportionately affected. For example, only 54% of African Americans surveyed were aware of the disproportional HIV and AIDS rates between African Americans and whites. They also found that 59% of Americans were aware of racial and ethnic disparities that disproportionately affected African Americans. However, this was a minute increase over the 55% awareness level found in the 1999 study. So we conducted a study to describe the disparities of perception and knowledge of maternal mortality in the US within the African American community and explore what drives these disparities and how we can change this and advocate for programs that will lessen these disparities. Given our current political climate, pandemic crisis, and growing support and awareness of the Black Lives Matter movement, this is a very timely and important topic. So our study sample was pulled from data collected in 2019 by Dr. Anthony and her Momentum Park team. The collection took place over 5 days at 2 national events in the US, one in Las Vegas at the 100 Black Men of America conference, another in New Orleans at the Essence Festival. And these were 2 unique sampling sites as they were at 2 predominantly African American events that were a very diverse group of people. And this allowed an easy and large sample size from our target population. Between these 2 events, 1,068 African American men and women were surveyed, of which 658 met our study criteria. Participants were electronically surveyed by a African American staff using a tablet provided by the Momentum Park team, or if they desired, they were given a link to complete the survey on their phones. After completing the 23-question survey, they received a fresh new $2 bill. And due to ease and simplicity of the sampling methodology, the total cost for this was less than $5,000, so very little. So on the screen, you see the DAG, and this was a theoretical framework for this research paper. Illustrated here, you can see the stepwise nature it takes going from proximal to enabling to predisposing factors. The proximal factors used in our study were how often one feels stressed, how often they have felt personally discriminated against in the past 3 years, how often they have thoughts about their own race and ethnicity, and their primary source of health information. Then the enabling factors were education level and the frequency in which they use informational technology apps and sources. Lastly, the predisposing factors we used were age, gender, region, marital, and relationship status. And this was a theoretical approach we're using to build our final multivariate models, as we believe that the more proximal factors that one is exposed to have the biggest impact on these issues at hand of perception, awareness, race, ethnicity, and health disparities. So we are exploring 2 exposures, and those are how often one has felt discriminated against in the past 3 years and how often they think about their race or ethnicity. Our outcome is perception, which has 2 levels. One was either categorized as perceiving maternal mortality as a big problem, or maternal mortality is a small, medium, or not a problem at all. And right now we're doing preliminary analysis, and I created some bivariate tables for you today looking at our key exposures and the outcome. And you can see this illustrated on the slide. We have not moved on to the multivariate analysis, so we are still working on that. And here in Table 1, we see that the odds of perceiving the problem of maternal mortality for African American women in the US is 2.2 times greater when one has thoughts about their race ethnicity every day when compared to those who never or rarely have thoughts about their race ethnicity. And in Table 2, we see that compared to people who rarely or never felt discriminated against, those who felt discriminated against often or every day, and those who felt discriminated against sometimes had higher odds of perceiving maternal mortality as being a big problem. And next steps, we'll be moving on to the multivariate analysis and then writing. So that was what I did this summer, and I'd like to extend a huge thank you to the Wallace Center and Momentum Park for your endless support and also making the funding possible. Doctors AMG for guiding me along this process. Maureen Lahef for helping me with some statistical analysis, and my ancestors for all the wisdom. And visit and follow us. Thank you so much.
Great job, Elle. Did you ever think you'd do a DAG after your capstone? You can go ahead and stop the share screen if you'd like, and we'll open it up for comments or questions from anyone, audience, or partners, students on the call. You're welcome to type in the chat, unmute yourself, whatever anyone would like to share comments or questions.
Hi, Elle. Good to see you. Miss you.
I miss you.
Oh, great presentation. And congratulations on your new position.
Thank you. Thank you.
And the great presentation. I wanted to ask you something more related to the content. Do the pods give any input on, for example, the educational portion of the sort of at the meeting? You said 1.5 and then 30 minutes is education. Do they give any input on what, for example, will be next week, or is just already all pre-assigned topics?
So right now, I actually, in conjunction with my boss, we created this program, and so we're still rolling out all the details. And I think what I would like to do is kind of that what to expect this week, but also, like you said, kind of give them a little bit of insight to next week or just like the future, because I think that the future and being pregnant can kind of be anxious, a source of anxiety and fear for women. And so knowing what's going to happen next will be really vital. So I think we'll do a bit of both.
Mm-hmm. Okay. Very exciting project.
Thank you.
Questions or comments from anyone else?
Hi, Elle. It's so exciting to hear what you and Dr. Anthony are doing. Really, it's just an extension of Mandola's. Like, what next? I mean, there's so many ways, and it could be for you or for the organization. Where do you see this going? Because this is such an exciting partnership for Wallace, and also now that you're stepping into this like more official role, what are your hopes?
Yeah. I think that what I envision for Momentum Park is this virtual park, that it's not necessarily just for these pregnancy pods, which I think will give us a lot of information on what works and what doesn't work. But this virtual space where women can go to at any time before they're pregnant, after they're pregnant, during pregnancy, and be able to interact with moms, be able to get resources, be able to learn. Part of our model is recording all the sessions so that those are available to anyone at any time. So I think going from pods into just like the greater world, I think is the bigger goal here.
That's really exciting. I hope you keep us updated.
Thank you.
Quinn, were you going to say something? I saw earlier you were like,
oh yeah, this is so cool. I've never heard of Momentum Park, and so I'm just, is this new? Is it like available to women now, or are you getting ready to roll it out? Like, where are you in the development of them? I'm so curious.
Yeah, Momentum Park is brand new. So it's still in that pre-seed phase. So we are applying for a lot of grants right now. And that will kind of guide us to where and the size of the pods that we can offer. Right now, we are still working out all the details, getting the speakers ready, and then hopefully we can do a pilot pod, which is it would just be one. Our full model would be multiple, around 6 different pods. But I think we want to try one pod first and see how it goes, and then roll it out and just keep extending it.
And do you have funding? Are you in the process of like looking for funding? Where are you in that?
Definitely.
This is so cool.
Yeah, definitely looking for funding every day. That's a big part of my role, which is new for me. And then the funding that we have right now is covering the cost of my position, as well as some other organizational things that needed to be funded. So yeah, just still in that pre-seed phase, trying to get everything off the ground.
Cool. Well, congratulations. Very
Thank
cool.
you so much.
The last question, and then we gotta move on.
Can I jump in?
Last one.
Okay. Thanks so much for presenting, Elle. It's really great to hear what you guys are up to. I just wanted to put in a plug, perhaps, for the Shiro project, which sounds super cool. I don't know if that's going to be like locally based with your pods or if it's going to be national, but I thought when you started talking about the referrals, it made me think about putting some of our partners in touch with each other, because I know that Find Connect has done so much research on making sure that their referrals, they're very local, they're like East Bay referrals, but they keep them very current. And I don't know, I think that they may do some partnerships with other organizations about that in terms of like sharing some of their resources. So just putting a plug for one of our partners and one of our other partners to talk to each other.
Great, thank you so much, Kim. I will be sure to email you.
Yeah, that's a great
I'd
idea.
just like to,
Oh, sorry, go ahead, Dr. A.
yeah, I just wanted to make a comment. I wanted to thank the Wallace Center for just, Elle was almost like a miracle that kind of fell in our lap at the last minute, because we didn't know if we had anyone. And she represents the MCAH program very well in how she received her education and what she brings to Momentum Park on behalf of moms and babies everywhere. Momentum Park is brand new. And to have her innovation, her brand new way of thinking, I wanted to have a very passionate person who fit what I call reproductive age, because for studies, I am not in the reproductive age model anymore, even though I still feel from a OBGYN standpoint, I'm reproductive age, but from a study perspective, when you're over 40, you don't count. And I learn from you every day, Elle, and what you bring to this organization. We're just happy to have you on board and to be able to say we have a Cal or a UC Berkeley, which I've had to learn over and over how to say it correctly, graduate as a part of our team. So welcome to Momentum Park and excellent job today.
Thank you.
Yes, we're very proud. We're going to transition to Andrea. Andrea, I've made you a co-host, so you should be able to share screen.
Okay, 1 second. Let me just get situated here. Share this. Chat. And present. Okay, awesome. Are y'all able to see this right now?
Yes.
Okay, thank you. Thank you so much for good afternoon, everyone. Thank you so much for joining me. Shout out to all the presentations so far. It's been inspiring to hear what other folks have been doing this summer. So my name is Andrea Mackey, and I'm a current second-year MPH student in health and social behavior, and I'm coming to you from Tongva land, so at Los Angeles. And I'm currently got to continue working on some of the work I've been doing this summer, which I'll talk about. I'm one of the program coordinators for Innovation for Youth, Youth Social Lab with Coco Roswald, and Ethnic Studies high school educator with Pinoy Panay Educational Partnership. So as a community organizer and as a community health worker, I'm coming here to talk to you today about my summer internship with Innovations for Youth, and my goal in empowering youth to assess the impact of COVID-19 experience on a youth experiencing homelessness and through the youth advocacy program. So, I want to invite you in the chat. 2020 was not what we expected. What comes to mind when you think of 2020? So in the chat, put it in, want to make this interactive, participatory. That's what this research is about. So I wanted to have y'all participate in this as well. What do you think about 2020? Chaos, yeah. Nine circle of hell, nightmare, unimaginable loss, yeah. Disappointing, yeah, exactly. So yeah, it's sad. All these emotions that we're bringing up, and if we think about these emotions and we think about the problems that we've seen play out, have always been here, but visibly see play out. Yes, please, let's fast forward. We keep seeing this word. Oh, let me see. Reimagine. Right? We have all these different. Reimagine public safety, reimagine education, reimagine LA. But what does this even mean? If we break down the word, re comes from Middle English, renew again, and then imagine is to form an image of, to represent, so imagine and conceive something in a new way, but who's not represented today? When we think about the future and we come up with solutions to these issues raised, we have to include the future. So how do we provide the youth, our future, the tools and skills and resources they need so they become these agents of social change? So they promote health and health equity in the community with continuous growth and development. So luckily, I was able to work with Innovations for Youth this summer, an organization that y'all have probably heard of. We seek to improve health equity and well-being for youth locally and globally, catalyzing innovative interventions and practices and policies, building interdisciplinary partnerships, between students and the community and collaborating. So my projects this summer centered around this framework, YPAR, Youth Participatory Action Research. And you can read it here, innovative approach that can redefine who has this expertise to produce knowledge in our world, provide the skills and inquiry and evidence and presentation that are important to young people's development for positive change, generate findings that provide insights that folks already know themselves, the research that matter in helping solve these issues, promote social political development and psychological empowerment, and evaluate these programs. And I started off with this YPAR, because if we look at these words and we think about participatory action, we're not just stopping with our data and research, we're acting on it. And so I was really lucky to have this, to empower the youth through one of my first projects, the Youth Advocacy program. And you can see some of my high schoolers that I worked with, Nana, Jojo, and Ava. And we developed this program, the framework for this program that is now carrying on this semester, and this whole year actually. And so, I can continue talking, but I think the better way is to have one of our high schoolers, Jojo, talk about, what is this program even about? So I'll let her begin.
Andrea, I think you might have to pull your headphones out of the jack.
Oh, okay, thank you. Usually, let me see, share computer sound. Okay, does this work now?
Hello, my name is Jojo. I'm a senior at Berkeley High, and I worked with Andrea on creating the Youth Advocacy program this summer. Essentially, it's a series of workshops in the fall annually that will train high schoolers to be better youth advocates. It's run by UC Berkeley faculty as well as graduate students, and other high schoolers like me function as youth advisors to make it more accessible to high schoolers, to help provide our input on what we think would be the best outreach, marketing, programming, etc. for the program. In these workshops, we're going to train high schoolers to become better youth advocates by giving them the tools they need to champion their beliefs. So at the end, they'll create a plan to advocate for whatever cause they're most passionate about. And throughout the experience, it's going to form a pipeline between a diverse group of high schoolers and UC Berkeley, so they can dip their toes into the college pool and get a little bit of that experience as well.
Yeah, so shout out to Jojo for providing this. I'm not sure if she's on right now. But yeah, so that basically summed up, we created this program series of 3 workshops. And as you can see here, this is what we designed. We developed this whole framework that is now currently being run. So I worked with 3 high school youth who really framed this all together, where, you know, the next set of youth advisory committee will be creating these workshops that, you know, will ultimately achieve our goals that we had set this summer. To one, create a pipeline, you know, for underrepresented students to be leaders in public health, education, medicine, get into UC Berkeley, who are our neighbors that we want to collaborate with. As well as, you know, right now the topic that we are talking about, which can be switched every year on what we're advocating for, is to advocate to decrease child marriage, against child marriage. You know, forced marriage victims often fall beneath the cracks, even within here, the United States. Dire consequences. We're talking about suffering from severe and lifelong harm, physical and mental health issues, barriers to education, domestic and sexual abuse. You know, our current laws and resources are not adequate to address these unique needs that are associated with this. And so our youth advocacy program will be able to connect high school students, developing this curriculum, develop leadership skills, improve problem-solving communication and thinking, and then also establish new strategies. We're online, we're on Zoom, we're always constantly learning, but also in thinking, if we're trying to be intentional with lower resource youth, to be in our program, to be in our school at UC Berkeley, how are we also addressing technology barriers or other sorts of barriers? So these are some of the things that we were thinking through this summer together. And so as you can see here, here's the timeline that we had put together for our program. By the end of the program, we hope students and youth in the community will know more about public health, gain practical skills and resources, support them to think critically for social transformation and personal growth. And so we aim to do this through this 3-stage cycle of leadership that I'd utilized in the past with a Lacoste mentorship program, you know, engaging with the self, you know, and our first workshop will be centering on educating on child marriage, you know. This is an educational component, but it's also identifying values and beliefs students have that motivates them to take action. How do they build community with each other within the cohort to develop a commitment to advocating against child marriage and developing a commitment to each other and themselves. They'll be partnered with undergraduates from the Youth Equity Scholars Program, mentorship program. They will be, by workshop number 2, what we're having them do is engage with others. How do they learn how to advocate? What is this common purpose that they have to develop new and creative solutions to public health problems? And how do they develop friendships, connect with each other? You know, it's a hard time to have friends nowadays, we're all virtual. And then ultimately, like Jojo had talked about, you know, advocate for our own community, developing a passion project that they can take home and bring to their community, design something that they're passionate about. And so we thought this would be a great way to incentivize retention, but also create something that they're passionate about and they can bring back. Personal, and ultimately, you know, we're providing leadership and advocacy skills and expanding on participants' network with peers and professionals. And so we wanted to make sure, you know, we developed this logo together, the Circle for Unity, the Advocacy Megaphone. So yeah, Ava had done this all on Photoshop, which was great. And then we wanted to make sure we were really intentional about our recruitment efforts. We want to make sure we are centering Black, Indigenous, and people of color from different clubs and spaces, learning communities here located in the Bay and so forth. Looking at, you know, the traditional routes, school health centers, at school administratives, but also utilizing the power of social media to really capture folks who might not traditionally go to college or might not see UC Berkeley as their final outcome. And here's some of the, you know, the challenges and successes and lessons learned that the students and I have put together, really looking at the power of collaboration. We developed a program that's intentional about challenging underrepresentation and arming the youth with advocacy tools and resources. Learned, you know, the challenges of retention, distinguishing between program and advisory board, you know, building a collaborative space on Zoom. And so this was one of the projects I worked on, and I mentioned there was another one, you know, how do we also empower youth using research and tool for change and transformation? And Research can help us better understand the problem, and it also helps understand our point, help others understand our point. And so this is the team. I'm also working. Coco, I think, is on here. So we're right now assessing the impact of COVID-19 on youth experiencing homelessness. Really understanding, what are youth going through, and it's particularly important considering, the disparities, the health disparities for youth experiencing homelessness, school failure, unemployment, mortality, lifetime chronic illness. And it's due to a lot of this social, political, ecological model that you can see here from the family, street, and community society. And so, in California, the term homeless youth generally refers to unaccompanied minors, ages 12 through 17, who are living apart from their parents or legal guardians, experiencing homelessness or unstable housing. So living situations like sleeping on friends' couches, staying in shelters, staying in bridges. But the issue is now that, youth who are experiencing homelessness are not only at greater risk to be infected by COVID-19 than their peers, but are greater amongst the populations at greatest risk by being affected by COVID-19. Most youth can't even shelter in place for reasons beyond their control. Resources that they depended on for communication, like electricity, Wi-Fi, are closed now. If we think, Coco and the team with Anu and Vivian had developed, looked at this report that was awesome and published, on the COVID frontline and hurting, addressing the needs of providers. So they looked at, what organization providers needed. And some of the things that popped up that folks recognize, medical services are now provided via telehealth. Youth experiencing homelessness don't have access to, computers and can't access these services. Access to water has been more complicated. There's shortages of PPE in the beginning, as we all know. Harder to get access to. And so what we're trying to do and what we're asking now is, with our survey, is it even possible, one, what is the impact of COVID-19 on youth in Alameda and SF? And then two, is it even possible to develop and employ this crowdsourced web-based survey, especially if we're talking about, less access to Wi-Fi and technology nowadays. And so this is all going to be done through Youth Participatory Action Research. And right now we're in the process of bringing in our team. We're developing community interns. And so I'm lucky to continue working on my project from the summer on into the school year. And so, like I said, here's our survey overview and some of our community partners with Covenant House and the Suitcase Clinic, where we're hoping to distribute the survey over 3 months to 300 youth. Really understand, what is, COVID-19 related changes to youth ability to engage in activities really necessary for their successful adulthood, transition to adulthood. And so as we're getting to close out, some of these, just reflecting back on some of, the challenges, successes, and where we're hoping to go forward is, we're creating, challenge for me that I face, we have to develop, this YPAR training curriculum over Zoom, building community online. The question is, how do we empower community interns with the skills and knowledge, especially folks who are on the streets or unstably housed at the moment. How do we challenge the stigma and beliefs of homelessness? How do we really conceptualize and imagine, create new possibilities, promoting collective narratives of transformative resistance, critical hope, and radical healing? I was able to write an IRB this summer, which I had never done. Didn't know, navigating academia is kind of new for me. I know how to develop programs, but yeah, so writing that IRB and really thinking through, especially because our study is focused on experiences of intersectionality of vulnerable populations, of youth experiencing homelessness, few resources, social support, most likely youth of color, LGBTQ. And we understand, this is a vulnerable population, so we really had to make sure we were ethical in how we were designing our project. And so, I loved the successes. We managed to get our IRB approved, which was a great feeling. We developed a great team. Super excited to, keep going. We're to have our full team with the youth community interns who are experienced homelessness, who are really going to dictate, where our survey is going to go, what do we need to, and ultimately, how do we utilize our research for change and transformation. You know, it's important to understand the use of data, and this idea of data is necessary but not important. You know, how do we make sure we emphasize the story? How do we make sure it's important that each data point is a human being with a lived experience with families and communities? And so really want to see, how do we really act on this? And so excited to see where this is going to go as we continue on. And ultimately, I just wanted to thank the Wallace Center and Innovations I4Y for giving me this opportunity to have such a meaningful internship this summer, especially in summer of 2020. You know, like y'all have been posting, this is not the summer I imagined. This is not how I've been feeling. It's been isolating. It's been weird. I haven't even met most of the people I'm working with in person. And I hope one day I can. And so I just really wanted to give a special shout out to folks in these pictures in the room right now. Ava, Nana, Jojo, Marika, Jessica Ross, Julia, Aaron Murphy, Graham, Indola, and then of course on the other team, we're talking with Coco, Anoop, Alan, Greg. Wow, I'm gonna go through a bunch of names here, but Vivian, Robson, Kaya, Jessica, and then always my friends and family and community who got me to this point and gave me the skills to even start thinking about these changes. So thank you everyone, and yeah, can't wait to keep reimagining with the youth.
Great, thank you. We only have time for one question. I do want to make sure that we give Minx time, and I know it's been a long day, but I also want to offer an opportunity for a question for Andrea. So does anyone want to ask a question or share a comment?
I'll ask a question. Hi, everyone. My name is Manuel Pedro. I'm currently a PhD student at UCLA Fielding School of Public Health. Also have my MPH from there. Wonderful job, Andrea. I guess I just wanted to know, how did this internship shape your idea of what you would like to do professionally?
Yeah, that's what I feel like a lot of other folks have been getting this question too. It's interesting because it was the forming point of where I was, the skills that I developed in, like the communities I've been with. You know, a lot of this has been like the leadership model that I use had come from stuff that I'd utilized before, the community organizing skills. In moving forward, it's interesting because, you know, a lot of the work I've done before as a community health worker has been with diabetes and chronic disease. So this was a different turn, even though it had been something I'd been working on. And so I'm still trying to figure out, how do I keep navigating? But the important point is still pushing for health and health equity. That's been consistent throughout everything. But also looking at, you know, how do we utilize the community a bit more? So I think that's, and utilizing youth. To really push forwards, projects forward. So I think that still, I can't give you a definite answer, but those are the themes that I'm still taking away.
I bet you everyone on this call is still figuring out that answer wherever they are in their career, so don't worry about it. Thank you so much. Such a great presentation, a lot of work. And thanks to I4Y. So we are going to transition. Minx, I have made you a co-host, so you should be able to screen share and get started.
Minx, I think you're on mute.
I'm sorry, please forgive me. I live in a place next to the BART, so sometimes BART comes by and interrupts my internet, so please bear with me. Just as a little bit of background, I have a Bachelor's of Science in Nursing from Samuel Merritt University in Oakland. I'm actually from Oakland, and I'm a mom. And so I was interested in this internship because I have a background also in community organizing with families, and I have a personal interest in environmental health and social justice. So this is my team. This is my preceptor, Dr. Curry. She has a degree in psychology, and she wears many hats in her community. In Fresno, for example, she's very heavily involved with the community with voter engagement, environmental justice, and she's on several committees which write and consult in regards to infant and maternal health. And she's truly a champion in the community and in our program. Just to give some background about the community that I worked in. So the Best Baby Zone initiative, as you know, was developed by our dean at the School of Public Health, Dr. Michael Liu. It's funded by the Kellogg Foundation, and it's place-based. And it addresses disproportionate exposures at sensitive times over the life course, and BEST stands for Advancing Birth Equity Strategies Together. So my focus was on the exposure of PM 2.5. And the significance of that is that it's particulate matter that's small enough to enter the bloodstream and cause disease. Some long-term health effects include lung disease, such as asthma, heart disease, diabetes, and more. And as you can see in my graph on the top right-hand side, African Americans experience a disproportionate amount of exposure of PM 2.5 than their counterparts. As you can see, a lot of it is industrial. It's from gas vehicles, diesel vehicles, construction, and what have you. And I'll tie that in a little bit more as we go through the slides. But two main articles or sources of interest. Stanford released a study in 2013 that drew an association between ambient air pollution and traffic exposures with birth defects in the San Joaquin Valley. And we're having, globally, we've turned an eye to the impact of PM 2.5 and its cumulative effect across the lifespan. So where is Fresno? Fresno, some of you may or may not know, it's in the San Joaquin Valley. It's the 5th largest city in California, and it's actually the 5th largest economy in the world due to agriculture related to almonds, livestock, poultry, and it has really a lot of mixed land use. So it's like industrial sites, vacant lots, former sites or current sites of hazardous waste storage, but also it's home to people. It's like a residential neighborhood. And it's known as one of the most polluted cities in the country, and unemployment is twice as high in the county in Fresno and twice as high across California. So they have an extensive history of exposure. They actually engaged in a 60-year battle with the Darling Rendering Plan, of which I'll talk about a little bit later. And the agricultural practices associated with harvesting almonds really contribute to the PM 2.5 exposure that the residents experience. And that when these are shaken and actually causes dust clouds, which contributes to exposure. And residents here actually, because the land is mixed use, they reside in close proximity to also stationary emission sources. And this includes like warehouses where trucks come in and out, highways, which also increases their exposure to PM 2.5. So this is Dr. Mary A. Curry. She's actually the mom of my preceptor. And as you can see, Southwest Fresno has had a very long, extensive battle with the Darling Rendering Plant, which started as a slaughterhouse in the 1940s. And citizens first started complaining in 1953 about the odor because, you know, it was a slaughterhouse. And over time, their offenses escalated. So there were like complaints of odors, spillage of like animal parts and animal waste, and operating without the appropriate permits. And eventually in 2018, they were sued. And in 2020, the concerned citizens of West Fresno actually won a lawsuit against the Darling rendering plant, and they decided that they were actually going to pack up and leave the city, and actually they actually agreed to pay restitution to the citizens if they weren't out by 2023. So a little bit about our population of interests. It's about 19,000 residents. There's a high concentration of poverty, and there's a severe disproportion in the health disparity of preterm births and infant deaths. And our focus for our best baby zone was census tracts 2, 7, 9.02, and 10, and we'll get to see them a little bit later. But folks in this area continued to experience social, economical, and environmental stressors such as food insecurity. There's only one grocery store, so they live in a food desert. There's a widening wage gap, of which these residents continue to spend disproportionate high percentages of their wages on rent, and lack of clean, green spaces. So Fresno Grows is the name of their best baby zone, and Grows is for growing rural opportunities in West Fresno. And so it's driven by African Americans to address African American disparities. And it's place-based, which means that it focuses on the disparities of those census tracts I spoke about in the previous slide. And they focus on community building through capacity building through regular community engagement, which means like they'll hold classes and things like that. They foster innovation, and they refine their programming by talking to other experts in the field or partnering with those in the community. Advocate for interventions across the life course, and increase social capital. And so what that means is that they'll offer courses or classes to moms in the area, or provide resources for others in the community to participate in their programming. So these are the census tracts that I spoke about. And as you can see, census tract 2 is on the lower right-hand side, and infant mortality is very high. 9.02 is above that. Census tract 7 and 10 over to the far left. And the one in the center just kind of gives a different view of all of the other ones. So in the city of Fresno, there's a there is a history of redlining, which means that the Homeowners Loan Corporation in the 1930s divided up cities based on a desirability. So green is the best, blue is next, yellow is like a declining neighborhood, red is defined as undesirable, and typically today are sites of disinvestment. And so redlining was really a systematic way to deny folks of resources and investment. So as you can see, the zoning map of Fresno really echoes the redlining practices of the Homeowners Loan Corporation, and also the general land use plan as well. And so if you look at the map on the right, you can actually see the little red area, which is near downtown, but that is where residents are actually butted up against industrial zones. So as you can see again here on this slide, redlining still, the effects of redlining still persist today. As you can see in the preterm birth rate map, they're highest in the area of West Fresno. I don't know, can anyone see my mouse? Yes, okay. So the highest rates are here, and then you go to diesel emissions from on-road and non-road sources in Southwest, so they're pretty high. And then if you look at poverty, single percent female headed households below poverty are also very high in that area also. So my internship objectives and deliverables were to create a landscape review, which includes a power analysis, not to be confused with statistical power analysis. And we'll talk about that more later. And also the program curriculum. So my curriculum development, actually so in writing this curriculum with my preceptor, I really wanted to attract folks from diverse professional backgrounds, whether they're students going into college or whether they're like grad students. I really wanted to attract a diverse group of applicants, which means that essentially if someone who is interested in environmental justice, but let's say want to go into law, they could pick this up and have a great baseline understanding about what it means, or whether or not they wanted to go into city planning or housing development or transportation. So I wanted it to really be accessible to many different types of folks, so that they can increase their awareness and continue on to make changes. So a power analysis is actually a tool often used in community organizing to assess the landscape and gain leverage among allies and the folks who live there for sustainable social change. And lots of social movements use them. This is not actually the power analysis. When folks are actually developing their power analysis, it's an inside strategy for their organization. And they don't share it with outside sources because then their leverage will be lost. But here you can see how it's outlined on the left. So concerned citizens of West Fresno would be an ally. Unorganized social sections would be like parents of preterm infants. Allies would also be Central Valley Asthma Collaborative. There's a city council. And as you can see over to the top right-hand corner, livestock owners and dairy industry, die-hard opposing groups. However, they have lots of power because of financial resources. So some of the skills I developed were community assessment from afar, critical thinking, networking, collaboration, and relationship development, which I really enjoyed. Curriculum development and tools for engagement and strategy. And so now I'm just gonna go over some of the other tools that I use. So I use CalEnviroScreen to visualize pollution rates in West Fresno, Community Valley Air, to really get a view of stationary emission sources in relation to West Fresno. And as this is West Fresno right here, it's very concentrated. Emission sources are very concentrated. Fire Air Now, air quality is a great concern due to the wildfires. And the nice thing about Fire Air Now is that it combines data about temporary and permanent air monitor placement across the city. And we were really able to see, where are the air monitors across Fresno, and how can citizens use this information. So some other highlights were that I got to attend a webinar with the American Lung Association on COVID-19, and their focus was PM 2.5 and the impact on the COVID-19 pandemic. This actually on the bottom left-hand corner is a title from New York Times. So there's a lot of research going into the impact of exposure to PM 2.5. I also got to attend the City Match Leadership and Maternal Child Health Epidemiology Conference, which was also online. Some titles of interest were addressing racism in maternal child health with reproductive justice and decolonizing gender in parent and child health. but what this also has given me was a stronger voice in my public health community. I actually had an opportunity to have my first opinion letter published in the Mercury News this past week. And without this experience, I wouldn't have had the proper paradigm to really convey this information to the public. And like I said before, I'm a mom, these are my sons, and I tell you, thank you.
Great job, Minx. Thank you. Congratulations on publishing in the Mercury News. That's a big feat. And I'm glad you're able to go to City Match. It's a great opportunity. So we'll open it up for questions or comments from anyone in the audience. Other students, faculty, staff, partners, feel free to unmute yourself or type in the chat box.
I'll just say, Minx, in my previous job, I worked very closely with Fresno Grows, and I really hope that, I was so excited to see that the work continues, and I hope that you'll get the opportunity at some point in time to go down and meet the people in West Fresno. They're really some of the most amazing people I've ever actually had the honor to work with. So I'm so glad you got to do this, and I'm so glad to see where the project has grown in the last several months. So congratulations.
Thank you so much.
I have a question.
Yes.
Minx, can you talk about, we're in such a weird time right now, and we're doing all this, so many of us do community-based participatory research that involves being on the ground and being in a community. And can you reflect a little bit on, how does that work virtually? What are in some ways it's great because we can bring people from outside in, but on the other way, you're missing this personal connection. So I just wanted your reflections on that.
I would say as an organizer, I worked in East Oakland, and so in order to really understand what these parents were going through at the school site, I wanted to go where they lived, breathe their air, where do their children walk to school? And I really wasn't able to do that. So I really had to do a lot of, it was really hard. It went against what I really want to do in public health, which is go and be with people and walk in their shoes with them, or walk next to them, maybe not in their shoes with them. So, I really had to get contacts from Dr. Curry, who is actually a resident who lives down in Fresno. And so I worked with her very closely. And I really looked at the local media down there, the Fresno Bee. So there's a lot of stories about what's happening down in the city. And I actually got to speak with a resident down there by the name of Keyshawn White, who was actually a high schooler who got a grant to do air monitoring and have air monitors at the different schools and really develop the skills to maintain the system. So it was a lot of both and plus some internet sleuthing. So speaking to folks who live there, really gaining insight from the academic materials that were out there, but also using other online resources.
Thanks, Minx. We are about at time, but if there's one more question, I think we are happy to entertain one more. Okay, with that, thank you, Minx. And I do want to say to those who are still on the line, to both the students from today and Friday, amazing, amazing job, blown away. And to our partners and preceptors, we know we thank you so much for working with our students, working with Wallace. It's really valuable to us. We really appreciate these partnerships and ability to train our students and support your work as well. And so we hope we can continue having some of these collaborations moving forward and connect you all with each other, and looking forward to our future work. So thank you all. I think we'll let everyone go now, and see you around.
Thank you.
Thanks, everyone.
For organizing, Marisa, and for
thanks, everyone. Congrats.
For helping with the schedule. Bye, guys.
Bye.
Bye.